Okay, we're going to talk about finding and treating trigger points in your forearm. So trigger points are knots in the muscles that can cause pain to radiate up and down your arm and can mimic the signs of carpal tunnel syndrome, such as numbness and tingling in your fingers. And this is my friend Gus, who's interested in my lacrosse ball. All right, lie down. All right, so to find the trigger points in your arm, you really need to dig in there pretty deeply. But if you feel between, you can rotate your wrist like this, and if you feel between the two bones in your forearm, you'll start to feel some of the tendons and muscles that run down your forearm, and you will often find some very painful knots in there. And what you can do is you can actually use your fingers to push on those knots. You really want to use some pretty firm pressure. And once you find a painful spot, you'll often feel it radiating down into your wrist. You can also use something like a lacrosse ball that can really help you dig in there. And you want to put pressure on these knots kind of as much as you can stand, and try to get them to feel less tight, feel like they're loosening up a little bit. The other thing that I've found works quite well is to use the elbow on my other arm. So I'll use my elbow. Usually I'll actually rest my arm fully on a shelf or something like that and really dig in there with my elbow.